everyone. This is Chalpal. I'm a second year medical student at GRMC Surrey. Today, the discussion topic will be the frontal bone. Let's start with the frontal bone. First, we need to face the question in the Bible, that is the anatomical position. We have to keep the bone like this, hold the bone like this, and we have to elaborate the anatomical position first. So it is the first you have to say that it is a frontal bone, and the squamous part, this part is directed upward, and the orbital plate projects horizontally backward from the supraorbital margin. This one is the supraorbital margin, and the nasal spine, this one is nasal spine, which is directed downward and forward. Now, what is the presenting parts of the frontal bone is this one is vertical squamous part, horizontal orbital part, and this one is the nasal part. And now we'll elaborate in each part. Squamous part has two surface and two border, the external surface and the internal surface, and this one is the parietal border or the posterior border, and the supraorbital margin. This one is known as supraorbital margin. Now we'll elaborate the external surface. This one is smooth and convex. There are some features of the external surface. The superciliary arch. These are the superciliary arch. This is known as superciliary arch. There is a glabella in which beautiful girls is a traditional ornament called tip. Then frontal tuber or eminence, just above the superciliary arch, there is a two frontal tuber from which, in the radical manner, the frontal bone will be ossified. Now, next question is the ossification of frontal bone is intramembranous. This bone will be ossified totally intramembranous. Most of the bones of the skull are intermembranous in ossification. This is all about external surface and relation. Now, relation of the external surface. There are two muscles like this. There are two muscles like this. The muscle name is frontalis muscle, and in between the muscle there is this epicranial epineurisis like this. Let's see. Yes, it is covered by frontalis muscle on each side, and in between there is epicranial epineurisis, and internally the saw will show this frontal lobe of cerebral hemisphere. Internally it is located. Now, features of the internal surface. As other bones of the skull, most of the other bones of the skull are marked by impression for the xyli. There is also, we will get the impression for xyli. These are the impression for xyli, and grooves for the vessels or sulci. These grooves are causes because of the pulsation of the artery. Now, next question is next features of the internal surface is sagittal sulcus. This is known as sagittal sulcus. In the sagittal sulcus, there will be lodgement of the anterior part, most anterior part of the superior sagittal sinus. In this lip, there will be a dural fold will be attached, known as fox cerebri. This will be also attached at the frontal crest. This one is known as frontal crest. Further we go, the frontal crest, we found the foramen caecum, through which the emissary vein which connect this superior sagittal sinus with the veins of the nasal cavity. In epistaxis, in the condition of epistaxis, we know the epistaxis caused during the increased intracranial pressure, and this emissary vein will act as a safety valve by preventing the vascular damage of the brain. Now, features of the parietal posterior border. This one is parietal or posterior border. This is a easy one. It forms the coronal suture with each parietal bone, means two parietal bone. It forms the coronal suture, and it is serrated. Now, next, the supraorbital margin. This one is known as supraorbital margin. Actually, it has two parts. This pointed and thin lateral 2/3, and medial blunt 1/3. Then supraorbital notch or foramen. There is a supraorbital notch or foramen. These are the supraorbital notch or foramen. These are the junction of the medial 1/3 and lateral 2/3. It transmits the supraorbital vessels and nerve. It is the most important one. And laterally we found the zygomatic process, which will articulate with the frontal process of the zygomatic bone and forms the frontozygomatic suture. Now temporal surface of the frontal. This one is each side there will be frontal bone, temporal surface. Here will be at origin of the temporalis muscle with the covering fascia, temporal fascia. And now we'll go. This is all about the squamous part. Next part is the nasal part. This one is the most interesting one because it is not much visible in the frontal bone. Which part is not visible? The nasal spine. This one is known as nasal crest. We can see in the picture, because anatomy is all about the picture. This total is known as nasal notch, and in between, in the midline, there is a nasal spine. This triangular portion is known as nasal spine. This nasal notch is one serrated one, and nasal spine is the triangular one, which is directed downward and forward. You can see here. And articulation of the nasal spine in front. This nasal spine in front will articulate with the nasal bone, crest of the nasal bone, and behind with the perpendicular plate of the ethmoid bone. There is amazing features of the ethmoid bone we'll discuss just in minutes. The nasal spine, this triangular part, which goes downward and forward and forms the part of the upper part of the nasal septum. Now nasal notch. This nasal notch is articulate with the nasal bone, frontal process of maxilla, and lacrimal bone. This curved one, which articulate with the nasal bone, frontal process of maxilla and lacrimal bone. And what do you mean by the nasal? Interesting one is the meeting point of the frontal bone with the two nasal bone. There are right and left nasal bone, and this meeting point is known as nasum. We'll further discuss in the pictures. Then now the features of the orbital plate. This one is known as orbital plate. It has two surfaces. This one is convex upper surface known as cerebral surface, and the concave one or inferior surface is known as orbital surface. And it has three borders actually: lateral border, posterior border, and a medial border. And now there is ethmoidal notch in between the two orbital surface. There is a U-shaped ethmoidal notch, and in the anterolateral aspect of this orbital notch, there is a lacrimal gland. Orbital part of the lacrimal gland lies in here, and from which there will be a pathway is introduced. We can see in the pictures. Let's see the picture. This one. This is known as the orbital part of the lacrimal gland, and this lower one is known as palpebral part. And here will be the conjunctival sac. Above there will be the liberated palpebrae superioris, and then here will be in the medial part there is a superior and inferior canaliculus which connected to the lacrimal sac. In the medial part we will find the lacrimal sac in the medial portion of the two orbital surface. Then this lacrimal sac further down, which will be as the nasolacrimal duct, and which will up in the inferior meatus, which is variably asked in the Bible. Now next features of the orbital surface is the borders: lateral border, posterior border, and the medial border. Posterior border of the orbital plate is thin one and serrated, which will articulate with the anterior border of the lateral bone, and lateral border is a triangular one, and it has a rough, this one. which articulate with the greater ring of the spinal bone, and medial margin. This one medial margin is articulate with the labyrinth of the ethmoid bone. And here there in the U-shaped area in between the two orbital surfaces there will be the cribriform plate of the ethmoid bone, which passes the olfactory nerves from the nasal mucosa into the cranial cavity. It is the most important question for the Viva. Then we found the frontal ear sinus in the orbital plate, just beneath the glabella on the each side of the superior, on each side of the on either side of the median plane within the frontal bone opposite the glabella. Medial part of the superciliary arch, there is separate the triangular portion. This triangular portion will be the frontal ear sinus. That's why it is called a pneumatic bone also. And this bone is, I've already discussed that it is as it is a pneumatic bone, and it's totally intermembranous in ossification, and its shape is cockle shell. And it's now next question is, what is the gross structure of this bone? Every bone has its own gross structure, like it is a outer compact and intervening diploid. Why it is called intervening diploid? Because it has a diploid vein. And what does the diploid bone contain? As it is a diploid bone, it contains the red bone marrow. And what is the morphological variety? I have already discussed. And these are the articulation. Here there will be the two parietal bone will be articulated in the parietal border or posterior border on the then a zygomatic processes from the frontozygomatic suture. I have already discussed the nasal notch, nasal spine. These are all about the frontal bone. Now we will go through the pictures that we can say. These are the frontal bone. These are the frontal crest. This is actually visible in a greater way in the book. Sagittal sulcus of superior sagittal sinus. This which will further there is a frontal crest. In front there is a foramen cecum, then nasal spine, nasal notch. And in the later there are some plate numbers of 4, 6, 8, 11 to 13. Here there is the totally frontal bone in front view. These are the lateral view. Here is the inner view. There are the impression and grooves. Here is another the lateral view in newborn child. There is a picture you can see the frontal ear sinus here, frontal sinus. That's why it's called a pneumatic bone. This is all about the frontal bone. If you like this video, please hit the like button and subscribe the channel. Good night.